Whether you're a guy or a girl, you can get free, confidential sexual health advice or treatment from the local NHS. There's a gum clinic in Wakefield called Josephine Butler. That's the one that I go to, and there's another one in Pontefract as well. GUM stands for genitourinary medicine, by the way, and it just means that they specialise in sexual health. You can get tested and treated for sexually transmitted infections, STIs, girls can get emergency contraception, and anyone can get help and advice about stuff to do with sex. I'm doing this film so you can see what to expect when you visit a GUM clinic. It'll show you what the place looks like, some of the staff that work there, and what to expect when you see a doctor or nurse. Hopefully, it'll make going there yourself a little less scary. When you arrive at the reception desk, you'll be asked to provide some personal details for your clinic records.
Yeah, I've got an appointment. It's Chris.
These are kept in the strictest confidence within the department. But if you don't want to give any personal details, please tell the
If you
receptionist.
want to take a seat, fill that in and just bob it back when you've done, okay?
You'll then be asked to go through to the waiting room. From here, a doctor or nurse will call you through for your appointment.
Chris? Hiya, do you want to come through? Just have your date of birth, please.
Usually, they'll call you through by your name, or if you prefer, you can ask them to use your date of birth. By the way, if you do decide to use a false name, make sure you remember it for when they call you through.
Come in, have a seat.
Once called through, the doctor or nurse will ask you why you're visiting, so that they can understand how they can help you. You'll be asked about any current or past medical problems.
Okay, Chris, so like I say, we just need to ask you some questions. Have you been to us before at all? Okay.
You'll also be asked some very personal questions, including ones about your sexual activity. For example, they'll ask if you've had sex with someone who's not from the UK. This is because some places such as Africa have a higher rate of STIs such as HIV. Be honest with your answers, so that the doctor or nurse can make sure that they do the right tests and provide the right treatment if needed.
And when did you last have sex?
If you've made an appointment because you think that you might have a sexually transmitted infection, STI, they usually have to check your tackle. Most guys think that if you're getting checked for an STI, they'll have to have a little umbrella thing put in the end of your penis. Don't panic, that's not the case. You'll just need a swab taken, and you'll need to provide a urine sample. This helps to look for infections. Before the doctor or nurse examines you, they'll talk through what is happening, and you can ask questions as well.
So what we can do then, Chris, is we can offer you a full checkup for all the STIs, such as gonorrhea and chlamydia. What that entails is we take a urine sample from you, which we send to lab. Anything we send off will go off with just your clinic number from here, so your confidentiality is protected. All your results just come back to us, so don't go to your GP. We can also offer you a blood test for HIV and syphilis, if you want to go ahead with that. And we can text you all your results. Is that okay with you?
Yeah, that's fine.
Okay, Chris, do you want to come this way with me?
The doctor or nurse will want to take a blood sample as part of your examination, so that you can be tested for both syphilis and HIV.
Okay, do you want to come in? Have a seat on the couch. Okay, Chris, this is one of my colleagues, Kim, one of our healthcare assistants, and she'll just be assisting me in the examination.
Hello, Chris, please.
Normally, you'll get your results a couple of weeks later via text message or a telephone call. You can choose the one that suits you best. If you choose the texting option and your test is positive, but you don't respond to the text message, the clinic will call you as well. If it is positive, it's important that you come back and get the treatment needed. STIs won't go away on their own, and you can cause long-term health problems if it's left untreated. If your test comes back positive for HIV, you will be offered care, support and treatment when necessary, which will help to keep you healthy. If you have any questions or concerns, please ask a member of staff. After all, they are there to help you.
Right, Chris, if you'd like to come with me to do a urine sample.
Treatment for an STI usually involves taking tablets and/or using a special cream. The doctor or nurse will go through how these are used. Treatment is free. If you're unemployed, on low income or on income support, you can claim back any public transport costs, as long as you have a valid ticket or receipt. The receptionist can give you more information about this. Once you are given the all clear, the best way to make sure you don't get an STI again is to use a condom every time you have sex. I hope this film has helped to show you that although you may be a bit embarrassed about going to a GUM clinic, it's actually okay. The staff there are really good. They'll treat you with respect and help to make sure that you get the right advice and treatment.